In this video, we're going to talk about the different components that make up an upper limb prosthetic device. This includes the terminal device, the socket, the various joints, and the method of suspension. The terminal device is the part that replaces the hand and fingers to engage in fine motor activities. The terminal device allows for increased function and grip in the form of either a hook, hand, or activity-specific device. A terminal device is designed for individuals who have lost their entire hand. For those that have undergone a partial hand amputation or transphalangeal amputation, there are devices out there that work specifically to provide some digit range of motion and fine motor ability. Here are a few examples of terminal devices. The prosthetist will help the patient determine which device will best fit the patient's needs and goals for prosthetic use. As an occupational therapist, it's beneficial to have a general understanding of terminal devices and how they operate. As a terminal device essentially replaces an individual's hand, it's helpful to have knowledge about hooks, hands, and activity-specific devices so you can help a patient successfully engage in activities of daily living. In this video, you can see how I detach the terminal device from the wrist. This whole part is the terminal device and the wrist is inside of the socket, as you can see here. When detaching a terminal device from the wrist, you simply turn the hand counterclockwise a couple of times and it will detach. A lot of people are a little hesitant when it comes to taking apart prosthetic devices, but they really are very durable. The wrist is a method of attaching the terminal device to the socket, and it can also allow for a return of mobility. Some wrists are designed to provide wrist flexion and extension, as well as pronation, supination, ulnar deviation, and radial deviation. Next, we have the socket. The socket is where the creation of a customized prosthesis begins. All sockets are custom fit for a patient based on their residual limb, skin condition, preferences for donning and doffing, and goals for prosthesis use. The socket can be personalized by the patient with various colors or patterns. Most insurances will cover the cost of a new socket around every 3 to 5 years, or when there's a physiological change in the patient's condition. The elbow is the portion of the prosthesis used to flex and extend the elbow. A prosthetic elbow allows for humeral internal and external rotation in the transverse plane. It can be manually pre-positioned by the patient. There are body-powered and myoelectric elbows and some that are also a combination of the two. Shoulder and higher-level amputations are not as common. Commercially available shoulder component options are limited, but still available for individuals who have undergone a shoulder disarticulation or a forequarter amputation. Most shoulder components allow for passive controlled humeral flexion, extension, abduction, and adduction. Suspension refers to how a device stays attached to the limb. For hand and digit prosthetics, straps or an equivalent are typically used to help keep the socket on. For people with wrist disarticulations and any amputation that occurred more proximal to the wrist, different types of suspension are required to optimize use of the device. Suction is a common method of suspension in upper limb patients. A patient typically has a flexible inner liner that they may push their residual limb into to help create a suction seal. In addition, a one-way valve found in the socket pushes out air, further creating suction inside the socket for a secure fit so that the device can suspend to the residual limb. The locking pin system is another method of suspension. A liner with a pin at the end of it is placed into the socket where the pin will lock into place. This method acts as a failsafe and will only detach by pressing the release button on the side of the socket. Something to note, when donning a prosthesis using the locking pin system, you should hear several clicks. These clicks are a good sign that the patient is fully in the socket and has a more intimate fit. Harnesses are more common for body power devices as they also provide control of the terminal device. There are two main harnesses for the upper limb, a figure of 8 harness and a figure of 9. Though there are more harnesses out there for more proximal levels of amputation, a figure of 8 and figure of 9 harness are the most commonly seen in the clinic. A figure of 8 harness is more involved, but it's also more supportive. It includes a control cable meant to transmit force through to the terminal device. A figure of 8 harness is used to provide both suspension and also control the terminal device. A figure of 9 harness is used strictly for controlling the terminal device. Although less involved overall, a figure 9 harness does require either suction or a locking pin system to provide suspension. Anatomical fit, although not as common, offers the most intimate fit out of any other method of suspension. Anatomical fit is made to suspend specifically on the anatomy of an individual's residual limb, including any bony prominences that remain. A bag may be used to help don the device by drawing tissue into the socket. The patient will place their residual limb into the bag and thread the bag through the hole in the side of the socket. This method makes donning the device easier and prevents any unwanted pull on the soft tissue. Now that we have gone over the various components involved in upper limb prosthetic devices, let's discuss which components apply to various levels of amputation. For fingertip to partial hand amputations, the prosthesis components involved can vary greatly. Some digits are all-inclusive and there's no clear boundary between the socket and the digit. Others have a very clearly defined socket versus digit, and some even include a wristband. You can see the variety in fingertip to partial hand prosthetic devices in these pictures. As you can see, there is a passive device on the left that has the goal of restoring a more naturalistic appearance. We have several non-restorative passive positional devices pictured here as well. Wrist disarticulations and below elbow components include a terminal device, the wrist, the socket, and a method of suspension. As we move more proximally, the only component that is added on top of the terminal device, the wrist, the socket, and some method of suspension is an elbow. Finally, for shoulder disarticulations and forequarter amputations, the only other component added is the shoulder joint. Which harness operates the terminal device and serves as a method of suspension? Is it a figure of 8 harness or a figure of 9 harness? The correct answer is a figure of 8 harness. A figure of 8 harness operates the terminal device and serves as a method of suspension. A figure of 9 harness only operates the terminal device. Even though a figure of 9 harness is less involved overall, it would require either a locking pin system or a suction system in order to suspend to the residual limb. Take a look at the picture on the left and see if you can answer the following questions based on everything that you've learned so far in this video. What level of amputation do you suspect this device is for? Is this a passive, body-powered, myoelectric, or hybrid device? Also, see if you can label the following components: the terminal device, the wrist, and the socket. It can be a little challenging to guess the level of amputation just by looking at a prosthetic device, but if you guess transradial, you're correct. If you remember from one of our previous videos, we used this device as an example of a myoelectric device, so the correct answer is myoelectric. Another clue is the battery that you can see on the side of the device pictured above. Based on everything that you've learned throughout this video, you should have a good idea on the various components that make up a prosthetic device and where they are located. A is the socket, B is the wrist, and C is the terminal device.